We all know that drinking alcohol on pregnant women can affect the fetus inside her womb. According to Ayer and West 2001, in the United States of America, it has been found that the alcohol used during pregnancy is the leading preventable cause of mental disabilities. Excessive maternal drinking while pregnant can cause FASD, or what we call fetal alcohol spectrum disorder. Fetal alcohol syndrome is a set of mental and physical disorders that can include mental retardation, brain dysfunction, physical abnormalities. FAS occurs as a result of prenatal exposure to alcohol. Physically, children with FASD may have small head and abnormal face features. As you can see the picture, the child has small eye openings, smooth white philtrum, and his upper lips is thin. Cognitively, these children may have poor judgment, lower IQ or intelligence quotient, have learning issues, emotional outbursts, and poor impulse control, so it has a higher rate of ADHD, or what we call attention deficit hyperactivity disorder. These developmental problems and delays persist in adulthood. Each organ of the fetus develops during a specific period in pregnancy, or what we call critical or sensitive period. When the fetus is exposed to the alcohol, it can affect the appearance of facial characteristics with FASD. So, pregnant women should and must avoid all alcoholic drinks to prevent this kind of disorder. We will on our television because we will watch a video about living with a fetal alcohol syndrome disorder.
I always judged people like me. Growing up, I thought a woman who drank while she was pregnant was just about the worst kind of monster there was. Hey, Nat, we have to stay away from the camera, okay? It's just gonna look at you.
Natalie, what's it like to be you?
I'm 6. Are you ready?
I'm ready. Are you ready?
Yeah.
What do you want to tell everyone?
I want to tell dinosaurs.
All right, tell them about dinosaurs.
Because I like the long necks.
Before Natalie came into my life, I was a mess, and I was drinking on a daily basis, and she was born at 28 weeks, so about 3 months early.
What's the best thing about Natalie?
She's the best sister I've ever had.
I was planning on giving her up for adoption because I couldn't take care of myself, so I certainly couldn't be responsible for taking care of somebody else.
What's your favorite thing about dinosaurs?
The Tyrannosaurus Rex.
What does he say?
Since the day she was born, that idea was never spoken of within my family. Like, we never revisited that subject.
We feel like we're friends, not sisters. But we're sisters. And not
She was in the NICU for 3 months from when she was born, and so during the first month I went back to rehab.
If you could tell the whole world one thing, what would it be?
I'm a horse.
You're a horse?
Every day I'm grateful to be alive. She saved my life. And then her sister came along, and we just became a fun little family.
La 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 la.
Use of any type of drugs, whether illegal, prescription, or over-the-counter can be dangerous during pregnancy. Illegal drugs such as heroin, cocaine, and methamphetamine can cause myriad of problems for the developing fetus. So, yung mga baby na pinanganak, may tendency sila na maging addicted sa certain drugs, and then may tendency din sila na ipanganak na premature at magkakaroon ng mababang timbang, and then makaka-experience din sila ng physical defects, and then problems sa attention and behavior. Prescription drugs taken during pregnancy such as streptomycin, tetracycline, some antidepressants, progestin, synthetic estrogen, Accutane, thalidomide, and DES, as well as over-the-counter drugs such as diet pills can also result in teratogenic outcomes for the developing fetus. Thalidomide, nagkakos siya ng bodily deformities, tapos nagkakaroon din siya ng damage sa internal organs. And then yung DES naman, yung exposed fetus, nagkakaroon siya ng high risk rates ng cancer. And then, pag adult naman, nagkakaroon ng infertility. And then, additionally, doon naman sa pagkaroon ng high dose sa aspirin, tumutungo ito sa maternal and fetal bleeding. And then, pag low dose aspirin naman, usually, not harmful siya.
Smoking is also considered as a teratogen because the nicotine can travel through the placenta, then in the fetus. When the mother smokes, the developing baby experiences a reduction in blood of oxygen levels. Smoking while pregnant can result low birth weight infant, premature birth, or the baby is not yet fully developed, stillbirth, or the death or the loss of the baby during the delivery of the mother, and another syndrome that can occur in the fetus is the sudden infant death syndrome, or what we call SIDS. SIDS is the sudden death of a less than year-old baby while sleeping. It also sometimes called as a crib death because the infants often die in their cribs. Inattentiveness or distracted, muscle tension, and colic, or a form of pain which starts and stops abruptly, or what we know in Tagalog is kavak, or other issues that can be caused by the exposure of the infant to smoking. The more the mother smokes or exposed to the secondhand smoke, the risk is greater on having those abnormalities. But quitting smoking can also reduce the risk of these problems.
Other teratogens that affect prenatal development include radiation, pollution, and infectious disease. Radiation increases the risk of childhood cancer as well as emotional and behavioral disorders. So dito, recommended sa mga pregnant woman na i-avoid yung x-ray dahil yung x-ray ay may radiation or unless absolutely necessary ito. Pollution such as exposure to mercury or PCBs, so nagkakos siya ng physical deformities, abnormal speech, and difficulty with coordination. So, mercury kasi is the chemical, and then when we say PCBs, ito yung mga fluids or mga man-made organic chemicals. Maternal infection, such as viruses or parasites, can also cause brain damage to the fetus or even death. So, yung common infection sa mga pregnant women is yung UTI or yung urinary tract infection.
Last factor is the maternal stress and depression. Any form of prenatal stress felt by mother can have negative effects on various aspects and can harm both the mother and the child. A stressed mother is more likely to engage in behaviors that can affect the fetus. Factors that can put a person at risk for prenatal development includes the unplanned pregnancy. This is unintended or unwanted pregnancy. Difficulty becoming pregnant. This can be having a hard time on pregnancy because of some health or organ problems like high blood or the mother is anemic. History of abuse. There's a certain traumatic happened. That's why it can lead to the stress or depression of the mother. Economic problem. If the problem is about the financial status or anything that involves money. Family problem. This stress can get in the family when there's a conflict or someone has serious illnesses or someone died from your family. Additionally, there are some other factors why pregnant women are experiencing stress. They are maybe dealing with the discomforts of pregnancy, like morning sickness, constipation, being tired, or having a backache. Their hormones are changing, which can cause their mood to change. Mood swings can make it harder to handle the stress. They may be worried about what to expect during labor and birth, or how to take care of their baby. In their work, they may have experienced difficulty on managing their job or task. They may be worried about how they eat, drink, and feel and how these things affect their baby. Using antidepressants has a variety of risks for the fetus. Depending on the dosage of it, can harm both the mother and the baby. One of the common stress that the mother experiences is the PPD, or what we call postpartum depression. It is a complex mix of physical, emotional, and behavioral changes that happen in some women after giving birth. A manual used to diagnose mental disorders, PPD is a form of major depression that begins within 4 weeks after delivery. The diagnosis of postpartum depression is based not only on the length of time between delivery and onset, but also on the severity of the depression. Postpartum depression is linked to chemical, social, and psychological changes that happen when having a baby. The term describes a range of physical and emotional changes that many new mothers experiences. PPD can be treated with medication and counseling.